Your path to a more active life. The following presentation is education for those having a total knee or a total hip replacement at Memorial Regional Medical Center. Memorial Regional Medical Center is part of the Bon Secours Mercy Health System. We are located in Hanover County, and we serve Hanover, the surrounding counties, the city of Richmond, and the Northern Neck and Middle Peninsula. We have disease-specific certification from the Joint Commission for our hip and knee replacement programs. The Joint Replacement Program at Memorial Regional includes a process that starts when you plan to have surgery with your doctor in their office, leading to your surgery and your care at home after surgery. An important thing to remember is that you must be an active participant in this process. Take part of your care. Make sure you read all of your education materials that you're given before surgery. This will help you prepare. You're given a joint book that has lots of information in it about your surgery. This can also be helpful for family members that may be helping take care of you after surgery so they know what to expect. Risk and benefits. The goal of this surgery is to give you less pain and a more active lifestyle. The risks, which we will work with you to help prevent these, but can happen, include blood clots, infection, falls, bleeding, damage to nerves or vessels, dislocations of a hip replacement, very, very rarely death or problems with anesthesia. You can help reduce the risk of these problems by reducing or stopping the use of tobacco products, limiting alcohol and avoid recreational drugs, eat healthy foods, frequent hand washing with soap and water, do your exercises and walk every day, and stay as healthy as possible and avoid being around sick people. Practice fall prevention, and it's very important to get up and move at least every 2 hours while awake. You should also maintain a healthy weight. All of the education that we provide is aimed at reducing the risk of these complications of surgery. Make sure that you're prepared and committed to the success of your surgery. To prepare for your joint replacement, you should start by choosing a coach or a helper to assist you after surgery. This can be one person or this can be a group of people who will be helping take care of you. This should be someone who is physically and mentally able to help you after surgery. If you are normally the caregiver for someone else for the first few weeks after surgery, you will need help with that. You will also need to help set up transportation to and from the hospital and to your 2-week follow-up appointment with your surgeon after surgery. You will not be able to drive immediately after surgery. You can also prepare your home for your after surgery time. You can start by stocking up on easy-to-prepare foods and making sure that you have necessary toiletries in your home so you don't have to worry about that when you get home. The best thing you can do is to prepare yourself to make your recovery easier. Things to consider prior to surgery. These are some of the things that you will do before your surgery. You will have the pre-admission testing appointment at the hospital. You will visit with a nurse who will review your medical history, your medications that you take on a daily basis, as well as giving you information about your upcoming surgery. You may visit your primary care doctor for medical clearance to be sure that you're healthy for this procedure. You should fill out your help at home log to make sure that you have available help when you get home after surgery. Limit your alcohol intake and be sure to drink your pre-surgery drink at bedtime the night before your surgery if you were given one by the pre-admission testing nurses. Not everyone will get these pre-surgery drinks, so if you were not given one by your nurse, then this does not apply to you. You can also prepare your home. You should clear walkways through your house and remove small rugs or cords that may cause you to trip when you get home. You can put night lights out for your bedroom and bathroom if needed to make sure you have a well-lit path to get there when it's dark. You could also stock up on easy-to-prepare foods so that that part of your care is easier for you once you get home. The day of surgery. You should complete any skin care as you were instructed at your pre-admission testing appointment. Drink your pre-surgery drink if you were given one, and be sure to arrive at the surgery center on time. When you come to the hospital the day of your surgery, you should bring your joint book and your incentive spirometer with you to the hospital. The first place that you will go is to the preoperative area. You will meet with a preoperative nurse who will review your medical information. You'll get your IV started, and the surgeon will come to see you. When the doctor comes to see you, they're going to mark the correct surgery site. What this means is he is going to confirm your name, your date of birth, and be sure that you understand the procedure that you're having done that day. The anesthesia provider will also come to see you to talk about your anesthesia plan or how you'll be going to sleep for this surgery. Once those steps are complete, you will go back to the operating room, and your family members or the person that is with you will go out to the surgical waiting area. The operating room and the recovery room. You will be taken from pre-op to the operating room for your surgery. When your surgery is finished, you will be taken to the recovery room. Often you will hear this called PACU. In the recovery room, they will make sure that you are awake and your pain is controlled, and then you will be taken to your room on the orthopedic unit. Your family members will be updated so that they know when your surgery is completed and when you're being taken up to your room on the orthopedic unit. While in the hospital, the goal is to discharge the day of your surgery, which means going home the afternoon after your procedure. In the hospital, you will use your incentive spirometer hourly while awake to prevent pneumonia. You will have physical therapy starting the day of surgery. Movement is very important after joint replacements. When you can empty your bladder, your pain is controlled, and you have been deemed safe to go home by physical therapy, you will be able to go home. Your coach or caregiver can be present for your discharge teaching to ensure that all of the information is understood. You will also be given a copy of your discharge instructions, which we will also call an after-visit summary, that will provide you with an overview of what is required after you leave the hospital. When you are recovering at home after surgery, you will have physical therapy. Your physical therapy may be through a home health agency where the physical therapist will come to your house, or you may have physical therapy at an outpatient facility where you go to the therapy office. No matter which route of therapy you have, you should remember that you should always work hard with therapy, and even on the days that you do not have physical therapy, you should do the exercises that they are recommending. Remember your infection prevention techniques: hand washing, controlling your diabetes, quitting smoking. Making sure that you're taking good care of yourself to help prevent infection is very important. We expect swelling of your leg, and it may become more swollen, especially after therapy. Use your ice, rest, and elevate the leg as needed. Bruising is also expected and sometimes is normal, especially if you're taking blood thinners. It will improve with time. Some redness around the lines beside your incision may occur as well. The swelling, bruising, and slight redness is expected and is part of your healing process. Remember, with this new joint, the best thing that you can do is to use it. Activity is very important for your overall health. Managing your pain. Managing your pain after a joint replacement surgery, whether it's a knee or a hip replacement, will include several things. The first thing I want to start by telling you is that we use the number pain scale that you often see in your doctor's office. The nurses starting at the hospital will ask you about your pain. On a scale of 0 to 10, with 10 being the worst pain you've ever felt in your entire life, what number would you give your pain? I want to start by saying, after a joint replacement, we expect you to have pain. We hope that your pain is very controlled and that you don't have a lot of pain, but pain should be expected. The key is to manage your pain and to keep it at a tolerable level for you. Starting in the hospital, the nurses, providers will ask you, what is your pain goal after surgery? Your pain goal should be a realistic number. We do not expect that goal to be 0. We will give you Tylenol scheduled every 6 hours to help manage your pain. We will also give you as needed pain medications called opioids, sometimes called narcotics, because these will help treat the more moderate to severe pain as seen on that pain scale. You should always record your doses and keep track of the medicines that you take when you're at home to be sure that you're not taking too much. You can stay ahead of your pain. Don't wait until your pain is severe to take pain medicine. If you have therapy scheduled, taking your medication 30 to 45 minutes prior to that therapy session will help with the pain. You should need less and less of these medications the days after your surgery, taking less often and taking a lower dose to gradually reduce the need. Use your ice packs for pain control as well. Even if you feel like the ice is not helping with pain, it does help with swelling, and we want you to use the ice packs that you were provided in the hospital. Some measures such as relaxation, musical therapy, and distraction are other good ways to help control your pain after surgery. Physical therapy after your joint replacement surgery. Remember that you were made to move, and early movement and exercising your new joint is the key to success. Expect to get out of bed with a physical therapist or nursing staff within a short time of arriving to your hospital room. Remember, the goal is to go home the day of surgery, so you need to get up and move. The therapist will provide you with exercises to do, and you should practice those often. When you're in the hospital, you should call for the nurse to assist you to go to the bathroom or get up in the chair. Anytime you leave the bed after surgery, you should have a staff member in the room with you helping you. When you're at home, you should continue the exercises and get up and move at least every 2 hours while you're awake, and gradually increase the distance when you go. Frequency is more important than distance in walking. You should use your walker or crutches whenever you get up. Therapy will advance you to a cane after you go home. If you do not have a walker, we can help you get a walker while you're here at the hospital. You will typically see a physical therapist, as I mentioned, either through home health or outpatient physical therapy when you go home. We will help you get this set up before you leave the hospital. And remember, motion is lotion. You should move every 2 hours while you're awake. The movement after a joint replacement surgery is very important. Good nutrition to help healing. You should put nutritious foods on your plate at every meal. Try to eat at least 3 nutritious meals a day, starting before surgery and for at least a month following surgery. If you are someone who does not like to eat 3 standard meals like breakfast, lunch, and dinner, if you are someone who prefers to have 5 smaller meals throughout the day, that is fine. Just make sure that you're getting all of the things recommended that you can see the picture on this slide. We want to make sure that you're getting protein, vegetables, and carbohydrates, because this will give you a balanced diet, and be sure to include the foods that are high in fiber with protein and vitamins to help your body heal after this surgery. If you cannot eat, or if your appetite is just not as it normally is, or if you are eating less than 50% of your normal meals, you can use supplements such as Ensure or Boost to help your body get what it needs to help yourself heal. You should drink plenty of liquids, especially water. One of the side effects of the narcotic pain medication is constipation. Drinking lots of water and getting good fiber in your diet will help you with that. Be sure that you're drinking, again, plenty of fluids after your surgery. Warning signs after surgery. When to call the surgeon's office. If you notice significant drainage from your incision, if your incision looks like it is more open, if you have pain that is no longer helped by your pain medicine, if you develop a fever, chills, or new numbness or tingling below your incision, you should call your surgeon's office or your doctor's office for guidance. If you have life-threatening problems, if you find it difficult to breathe, if you're coughing up blood, if you have chest pain, a sudden weakness, difficulty speaking, or if you have increased anxiety or difficulty when trying to take a breath, those are problems that you should call 911 and come to the hospital for. Keys to success. Get as healthy as you can before your surgery and focus on staying healthy after surgery. Remember to do your therapy, the walking and exercises that your physical therapist tells you that you should be doing. Eat nutritious meals every day before surgery and during the recovery period after to heal more quickly and to prevent infection. Make sure that you're getting good quality sleep. And remember, we do not want you to take sleeping pills while taking the narcotic pain medicines. Stay away from sick people, and remember, frequent hand washing is the key to prevent infection. You can shower starting the day after your surgery with clean towels and clean clothes near your wound only. You cannot take a bath or sit down in water where your incision or your wound is underwater. We do not want you to do that until you're told by your doctor that it is allowed. You should not get into a pool, hot tub, or any bathtub until the doctor says it's okay. If you have a dressing and it is waterproof, you may shower with it on. Dry off as you normally would dry off, just pat the dressing dry with a clean towel. Remember also that you should use your ice packs pretty constantly, especially when your leg is swollen. You can change the gel inserts to the ice packs that we gave you every 4 hours. We will give you extras to take home so that you can have your ice pack on your leg and a set of inserts in your freezer at home so that you can regularly switch them out. Remember that term, motion is lotion. Move at least every 2 hours while you're awake. Remember also to prevent falls. Make sure that when you're walking, you have a safe walking path and you're walking with any devices that you were told to walk with. What I mean is that if the therapist tells you that you should be using your walker, you need to use your walker when you're up and moving. Inspect your wound and swelling at least daily. If you notice anything different that is alarming that we discussed earlier, notify your surgeon's office. Life with a joint replacement. Once you have a hip or knee replacement, you should tell every medical provider who takes care of you to be sure that it's added to your medical records. Do not have any dental work done for 6 months after surgery unless it's urgent. Anytime you have dental work done, teeth cleaning, fillings, a root canal, you should take an antibiotic. It is not a several-day-long dose of antibiotics. It is usually 1 dose taken an hour prior to the appointment. This will be for the rest of your life after joint replacement surgery. It is to prevent infection. Your path to a more active life. Remember the activities that you had to stop due to arthritis and enjoy them. If you were someone who would previously walk with a group of friends on Wednesday mornings and you were unable to do that before this surgery, the goal is for you to be able to do those activities. Keep on your path of activity and taking excellent care of your overall health. We look forward to seeing you and hearing the improvements in your life after surgery. We want you to have a more active life with less pain. We want you to be able to do tasks such as going to the grocery store, going to church, or going to social functions without significant pain. Thank you for choosing Memorial Regional Medical Center for your orthopedic care. If you have any questions after this presentation, you can review your joint education book. It has a lot of information about your surgery. If there is anything that we can do to improve your surgery process, please let a member of our staff know. Thank you again for choosing our hospital, and we look forward to getting you on your path to a more active life.